It's Wellness Wednesday, everybody, and that means it's time to ask Dr. Ellen. We're asking her today about ultrasounds and their use in treating back pain. Dr. Ellen, how are you?
Great.
All right, so ultrasound. I always think of a new mommy, but you're saying that ultrasounds can help us with our back. How is that possible?
Okay, well, back pain, as we know, can be caused from many different sources. Many different pain generators can make someone feel that they have pain in their back. So one of the things that we always try to do at Southeastern Spine Institute is make the correct diagnosis for the back pain. And sometimes the back pain can come from joints in the back. And as we know, joints can become inflamed, and when joints become inflamed, we often call that arthritis. Right. So anytime one of the most common ways that we're using the ultrasound right now in the practice is we have a lot of people that have pain in their hip, and sometimes it's also felt in the back or going down the leg, but it seems to be coming more from the lateral aspect of the hip. And it's very tender to touch. People will often tell me, well, I can't roll over on my side at night while I'm sleeping. When I do so, it wakes me up, this sharp pain in my hip. I mean, a lot of times that's something called greater trochanteric bursitis, basically a bursitis, inflammation of a bursa at the top of your hip. And so what you can do is, using ultrasound guidance, we can inject that bursa very specifically under the ultrasound in our office now. And it's great because previously I would do these same injections, but we were scheduling them under the fluoroscope or the x-ray. So this is great because it allows patients to come in and have it done often on the same day that they're in the office seeing us for just a follow-up visit. And it saves them exposure to radiation. But lots of things can be injected under ultrasound, not just the hip. Knees and shoulder blocks are also done under ultrasound. So we're really finding a lot of great ways to put it to use in the new office.
Okay, so it's just another way that you can kind of bypass surgery if it's possible.
Yeah, another way that's more of a conservative treatment that's not surgical, that can make someone feel better and definitely improve their quality of life.
Okay, if the ultrasound by chance doesn't work, Dr. Ellen, then you'll give somebody other diagnosis. Maybe they can get something else done. But I just like to always reiterate to people that you don't go and say, the first thing we need to do is get surgery. Oh,
yes, absolutely.
Okay. Because a lot of times they see Southeastern Spine Institute and they say, oh no, I don't want to go and get a surgery, I just want to feel better.
Exactly. We have many conservative options at Southeastern Spine Institute, and we always do try to start with the most conservative medications and therapies first and see if we can get people back to normal those ways first.
And you've expanded your campus into the beautiful new building. I've been in the building and it was truly amazing, state of the art, and everything is kind of like under one roof.
Right, it's great. You know, it's an expanded campus. We now have another building next door, just more room for physical therapy, more room for other providers. So really everything all under one roof, which is great for our patients.
Love it. Well, Dr. Ellen, you can see Dr. Ellen if you need to over at the Southeastern Spine Institute. It's right here in Mount Pleasant. You can even call them. All the information is right there on the screen. If you ever have questions for Dr. Ellen, we would love for you to send them in to us. All you got to do is go to abcnews4.com and click on the Low Country Live tab, and you'll find the Ask Dr. Ellen segment right there. Thank you so very much, Dr. Ellen. We really appreciate you being here. All right, see you next Wednesday.
Sounds good.
All right, a Low Country professor wants to keep young minds in tip-top shape. That's just ahead here on Low Country Live. And it's time to remember a battle fought 150 years ago. This battle began the Civil War siege of Charleston. How you can learn more, that's coming up next.